Hello, everybody. How's it going? Good to have you back here on Law, Liberty, and Logic with your host here, Jamie. And we have a very special topic today. We're going to go into something that's kind of interesting with elder care and Medicare, hospice, skilled nursing, and things like that. But before we get into that, if you have not already, make sure to go ahead, hit that subscribe button, click the notification bell so you get updated whenever I got a new video coming out, because these videos are very informative and useful, and they can definitely help you out in many different ways. So you don't want to miss out on any of that, and make sure to hit that like button once you finish the video, so that way this gets boosted in the algorithm and we can get more people to see these very important things. So without further ado, I'm going to go ahead and jump right into our topic of Medicare, hospice, and skilled nursing home stays. These are some key issues to consider. What I am presenting here is what you might be facing and having to think about when you're considering how these things intersect with each other. And I will explain all these things, especially if this is new topics for you. Maybe you have an elderly parent and you're starting to, look into what you're going to do to help them and what services they might need. Maybe it's for yourself down the road. You're thinking about what services you might need, but whatever it is, I hope to help your food for thought process here and avoid some pitfalls. So as always, this information is for informational purposes. This presentation is for informational purposes only. It is not intended as legal advice. So make sure to talk with your own healthcare and legal professionals. Consider unique circumstances. Again, this information is just generalities. Your situation might have special nuances, so you definitely need to see what things might come up for you in your nuanced situation. But at least this will get you going thinking about what questions to ask. So the background issue here is that many elderly people reach a point of needing specialized care under 24/7 watch. I've personally experienced this just recently, this issue with my own father, who sadly passed. But he got into a situation where he had a memory issue due to cancer that had spread necrotic tissue to his brain, sadly. So that's one of the many real issues that comes up with people and having to deal with elderly loved ones and how they might need help. So nursing homes often provide the specialized watch care with skilled nursing services in addition to room and board, right? So nursing homes, if you're not familiar with those are, it's basically a facility where there are both beds for the patients and there's doctors and specialists who are providing special care and providing other types of services and food and so on and so forth. So affording a nursing home stay can be very expensive. So it is crucial to understand what is covered with Medicare, as most have Medicare as a primary insurance in their sunset years. Depending on who you are and where you're at in your life, your coverage, your medical coverage, might shift or this or that depending on what you're old enough to get. Because people are forced to pay for Medicare, many people are on Medicare once they reach that retirement age and they're pulling Social Security. And that's often the demographic here that's going to be going to a nursing home, most typically those who are in their 60s plus. Some people will have a secondary insurance that covers things that Medicare doesn't. Others may not. So those are things that you're going to have to sit there and think about in your own situation, or if you're thinking of it for a loved one. So nursing home entry is usually on the heels of a major life event, such as a hospital stay that demonstrates an elderly person needs specialized rehabilitation care. For example, my father, he was in the hospital for several days because of brain inflammation. And, it could be a fall and someone gets a major injury and they're old. It could be, something else with Alzheimer's, dementia, and then that leads to something else. Usually you're going to be needing to be in that hospital stay for several days, usually 3 days before you get put into a nursing home and qualify for that benefit. So the person entering a nursing home is doing so because they can't take care of themselves and loved ones are unequipped to take care of their needs at the professional level. While many people might want to help out with a loved one, it might require very specialized care and watch. You need nurses who are administering things specially through IVs, or you need rehab professionals, or you need someone who can watch them 24/7 because they might try to escape. Sadly, in my own experience, my father was in that position where he was a flight risk. And so we needed people who could, be there 24/7 because, of course, you have to go to sleep at some point and you can't be up 24/7 and see if your loved one is trying to run away. So you need nurses who are there and awake through the night and shifts so they can take care of people who are in that situation. So those who don't need this level of care but who need some care usually go to an assisted living facility instead, or have a part-time nurse doing home visits. So, if you're not in that bad of a situation, Usually you're going to be maybe with an assisted living facility where it's kind of lighter help, or maybe you're still at home and nurse comes by, or maybe family takes care of you. It's so, nursing home is that next level care that, where someone really needs that 24/7 care and watching. Nursing home stays can be expensive, with some places running $20,000 plus per month or more. I just received, one of the raw Medicare bills. And just for 25 days, it was over $16,000 billed to Medicare alone. So, it's pretty hefty on the billing. And so it's, even if you try to pay cash prices, it's still not cheap. So it can be difficult to know exactly how long a patient's going to stay, because sometimes people do rehab, some people, and they make it. Sometimes they just get worse and they pass. In my case, my father just sadly passed after 3 months. So you don't know how long, it's going to end up being, but a lot of people make it longer. Some don't. So, so for families, they're trying to afford the nursing home stay, and that can be daunting because they don't know whether or not, their loved ones, insurance is going to cover it, or whether it's going to run out, and what they'll do in that case. So it's kind of scary. So Medicare will cover skilled nursing stays, but only under certain conditions and periods. So it's just important to be aware of what that looks like. So under Medicare, you need that qualifying hospital stay at least 3 consecutive days as an inpatient hospital, not including observation status or day of discharge. And then the admission to a SNF, which is skilled nursing facility, must occur within 30 days of hospital discharge. So, this is going to be a situation where someone's at a hospital for several days, and they're like, yeah, we're not going to be able to rehab you. They got you maybe stabilized enough, but it would require, a hospital stay normally, but in your mainline hospital, they don't want to have those beds kept up for people that technically are relatively stable. So that's why they put people into skilled nursing facilities, which technically are also hospitals. Like there's places where it's technically a hospital per se, in terms of what the facility is, but they provide other services for longer term stays. And of course, hospitals are even way more expensive. So you don't want somebody at an even more expensive place where they're more stabilized situation. So what's required then for that skilled nursing under Medicare? Well, you need medical necessity. So you need skilled nursing or therapy services. Could be physical, occupational, speech therapy daily, which can only be provided by or under supervision of skilled professionals, right? So they're doing things to usually help someone walk again, or to help them speak, or to help them with tasks and motor skills, right? That kind of thing. The services must be needed for a condition treated during the qualifying hospital stay, or one that arose while in a skilled nursing facility care. So, most commonly, having been through this process recently and watched it, it seems like a lot of the therapy that's done typically in skilled nursing a lot of times has to do with motor function. It has to do with people who got injured and they're learning how to use a cane or walker, or just being able to walk at all, and they're trying to rebuild muscle after, being down for days, and, they're elderly, so it takes a lot more to get them back to functional. So a doctor must certify the need for skilled care and establish a plan of care. So that physician certification. The beneficiary must be in Medicare Part A and have the benefit of remaining days. That is, you got a certain number of days that they will cover, up to 100 days per benefit period. A lot of times it's about 90, but there's technically up to there potentially. There's always nuances with these things. So that's a generality. The care must be received in a Medicare certified skilled nursing facility. So you can't just put anybody willy-nilly anywhere. It has to be in that Medicare certified facility. So the benefit period limits, as I was just talking about with the 100 days, this coverage for those 100 days is just that starting point. It's not all time. There's no limit on the number of benefit periods, but you have to requalify once you close out that benefit period. So basically, if you go through 100 days, you're going to lose any sort of coverage whatsoever, not partial or anything. You will have to stay out of a skilled nursing facility for 60 days without being an inpatient hospital or at a skilled nursing facility. And then you can renew that benefit period with a new qualifying 3-day hospital stay. So it's kind of funky. I don't know how many people are even able to manage that. It seems kind of weird or wonky, but I guess it happens for some people, but I think for what I've seen, a lot of people either end up coming out by the 100 days and, they're able to kind of function, or they die. It seems to be that, those are the two most common paths. So, again, you need to have that benefit period run out, and then you need to have the same, process each time, where you got to be 60 days without any hospital or skilled nursing care. Then you get a new hospital stay, and then you have to make sure you're in within 30 days. So, usually it's just a one-time thing, but it's something to think about. Now, the Medicare coverage periods, it's not all the same in terms of what it is that they cover. So Medicare will cover 100% of the cost if you meet all the conditions for days 1 to 20. So if you're in the facility, for 20 days and you checked all the boxes before in terms of what you needed, you're good to go. You're not going to need any copayment or coinsurance or anything. Once you hit day 21, though, then there are some issues that come up, because Medicare will cover most costs except a daily coinsurance amount of $216 per day. And that's the most up-to-date rate. I think it was like $209.50 when I was doing it. And that rate is updated over time. So, the amount can change. Of course, it'll probably be changed by the time many are watching this, just because they're updating it all the time. But that amount is not going to be covered. So you're paying $216 a day on days 21, so on and so forth. So if you don't have the ability to pay for that, or you don't have a secondary insurance covering that, that's a serious issue. Obviously, that is going to rack up a lot of money. In my situation, my father had a secondary insurance, which is strong. I think there was and even that insurance didn't cover everything. Is like they covered 80% of it, but after you cover 80%, it was doable. But still, it's an issue. So you have to be aware of that. Beneficiaries are responsible for the coinsurance unless covered by supplemental insurance, again, like Medigap or whatever. So, if you didn't already have that, or maybe you're planning for your end-of-life care and you're starting to think about insurances, and you might want to have a secondary insurance that you get to pick up that other part. After day 100, though, Medicare provides no coverage for skilled nursing facility care in that benefit period. So you hit a day 100, you get no Medicare whatsoever. After that day 100, you're going to have to pay 100% of everything if you continue to stay, and that could be a big issue. And there's special legal tools to deal with that, but that's not the focus of this. Is just more so the issues here with Medicare and hospice. So hospice is often misunderstood. I certainly didn't fully understand it myself before I had to deal with it. I mean, really didn't have a reason to think about it. Most people in my life were relatively young and healthy, and didn't really need to think about it too much until recently. So hospice is not typically some facility that people go to. It's not like a nursing home. It's technically compassionate palliative care for terminally ill patients with a life expectancy of 6 months or less, focusing on comfort and quality of life rather than curative treatment. So hospice is really about giving people pain management. That's really what it boils down to. And it's about giving people this pain management in the context of where they're at typically. So hospice nurses are going to go to a skilled nursing facility. They might go to a home. They're going to bring those treatments to the patient. It's not a building like the skilled nursing facility where people stay for a long time. There is hospices will have a building that people go in for a very short window, like 5 days. It's a nuanced thing. We'll cover that later, but it's important to note that hospice is not the same as skilled nursing. It's separate function, specialized medical professionals. They're providing treatment specifically to remove pain. It is and not to treat someone to cure any of the disease, right? So if you go on hospice, you're going to have that care affect your Medicare coverage of skilled nursing, because hospice is about ending anything that could cure somebody. They're not going to be treating with cures. It's just about the pain relief, because they expect someone to die in a short period of time. So hospice, what does it require? If you want to try the hospice route, well, you got to be enrolled in Medicare Part A for that Medicare coverage, certified by a doctor and hospice medical director as terminally ill with a prognosis of 6 months or less that the illness runs its normal course. So that's a big important part, is that they have to say you're going to die within 6 months. If it's later, then you're not eligible, at least for Medicare's coverage. The patient agrees to forego curative treatments for the terminal condition and elects hospice care. So this is very important, because if you choose hospice as the patient or as a healthcare surrogate, you will no longer be covered for curative treatments. They will no longer do curative treatments. They will just focus on pain management, like morphine. So it is going on to hospice, in my opinion, is almost kind of like a death sentence, because you are at that point saying, okay, this is it. It's basically, there's no chance, they're coming back out of the situation. This is, it's time to let go and just focus on making the path out smooth and as painless as possible. So a lot of people use hospice or think hospice is this magical thing that's like, oh, I could just go do this and there's no consequences or anything like that. And that's not the case. Hospice is actually a serious decision that you really only want to make when you're ready to do, because it's basically, it's your time to go. And not just that aspect of the medical part, but there's a financial part. So, and we'll talk about the financial issues in just a moment. So the covered services with hospice is that you get nursing care, medical equipment like hospital beds, and supplies related to terminal illness. You get physician services and symptom management medications, physical, occupational, speech therapy for symptom relief, again, not curing, social work, counseling, spiritual support for patient and family. So they'll ask, if any family members need a counselor, someone to talk to, they'll offer, a pastor, priest, potentially, for the person. We didn't elect any of that for my dad because everything was good on our end, but it's, it's something that comes with that whole cadre of different services. You can get hospice aid and homemaker services for personal care potentially, and short-term inpatient care for pain and symptom management or respite care up to 5 days per episode. So in a rare situation, someone might go to a hospice physical facility, but it's not long-term. It's like up to 5 days. And usually it's either giving relief to a caretaker who's overwhelmed, or there's some weird medical thing that comes up that's kind of crazy with pain and they need like an extra special team and to pull them away from a skilled nursing facility for some reason. So it's not a general, hospice is the place to stay like a nursing home is. So hospice, if you've qualified, there's no cost for most hospice services under Medicare Part A, up to a $5 copayment per prescription for outpatient drug symptoms control, up to 5% coinsurance for inpatient respite care. That's just basically if they have to go in for the 5 days or whatever. But by and large, hospice is covered by Medicare Part A. Your care settings, they're provided in the patient's home, hospice facility, hospital, or nursing home, and must be delivered by a Medicare certified hospice provider. So the duration of coverage is an initial 90-day period, followed by a second 90-day period, then limited 6-day periods the patient remains eligible. So it basically kind of goes on forever as long as they literally met the conditions, as long as the doctors genuinely believed, yeah, you got 6 months to live, you're going to keep qualifying pretty much. A patient can revoke the hospice selection anytime to resume curative treatment, but pretty much if you've gotten that official doctor's note and the doctor's like, yeah, your conditions, your cancer, this or that, yeah, sure, maybe you hit the 6 month mark, but you're definitely going to die soon. They're just going to keep you in basically. So the non-covered services are treatments or medications aimed at curing the terminal illness, as noted before, care from a non-Medicare certified hospice provider. And here's the big one: room and board in a nursing home or hospice facility, unless for short-term inpatient care. So this is where it gets really important to pay close attention, because a lot of people will jump onto hospice right away and not realize that if you jump into hospice, you lose your room and board coverage, which means that the skilled nursing facility could be charging you a day rate all of a sudden. Whereas before, if you had skilled nursing under Medicare and you weren't doing hospice, Medicare would be covering the room and board. So unfortunately, I had looked into this before, and I even had been warned by the facility, like they were kind enough to just say, hey, by the way, a lot of families will jump into hospice right away, not realizing that they're getting charged $320, $350 a day. And by the end of the month, they got a $9,000 bill. And they're like, what the heck? Because they just got charged that rate, a daily rate, for room and board since they elected hospice, and they've lost their Medicare coverage of room and board that they would have had if they just waited to do hospice. So again, hospice is not just something that's serious in terms of giving up any curative treatment. It is also going to kill your benefit of having your skilled nursing room and board covered. So don't do hospice right off the bat if you can, and you don't want to get charged for that. Hospice, I think my experience is that it's really meant to be when someone is on that turn, when you see they're like starting to not eat, you're starting to see they're losing weight, and you're like, okay, this is it. The nurses usually will tell you at the skilled nursing facility, it seems like they're going to go. And a lot of times people can ballpark it within 1 to 2 weeks. And that's the time to go on hospice care, is when it's like, okay, this is it. This is on their turn. They're not holding an appetite. They're losing weight. Okay, let's get them on medicine to help them. So these, again, are the critical issues. Just got to emphasize it here. If you elect hospice, you will lose the room and board coverage benefit of Medicare's skilled nursing coverage. You don't want to lose that if you don't have the means to pay the daily rate. It's very expensive. So avoid going on hospice until it's time, unless you're just got all the money to throw at it and you're like, no, I prefer this. Well, that's up to you, I guess. But you're going to end up spending a crazy amount of money when it probably wasn't needed right away if they're not in that turn phase. So many hospice professionals will not be forthright about this. And I experienced that. I talked to a hospice, 3 different times over months, and not a single one of them mentioned this aspect, which I just found surprising. Unfortunately, I already knew it because I looked into it and I, had known it from early on, but I couldn't believe that no one of their own accord was like, oh, by the way, if you choose hospice, you're going to lose your room and board benefit. Because at the end of the day, some of these people just want to get you in, and they do it under the pretense of compassion. That's great. But I think they should be informing you that, by the way, if you choose hospice, you lose your Medicare room and board benefit. It's a big deal. So, don't get shocked. That's my big takeaway here. Don't get shocked by a sudden bill. Make sure that you think carefully about where your loved one is or where you are in your progression. And, unless someone's in significant crazy pain where it looks like they're going to go, it's usually best just to wait until the turn to go onto hospice. So again, that on the blue, it says Medicare S&F benefit. Again, that's at 100 days. So you do get up to 100 days of some type of coverage, and it's something that you just kind of have to sit there and look at your finances and look at everything as a totality, and see what makes sense. So there's these rare small exceptions for short-term inpatient care. With hospice, we were talking before. This is just laying it out more generally. Medicare covers room and board in a Medicare certified hospice facility, hospital, or S&F for short-term stays if needed for intensive pain or symptoms management related to the terminal illness that cannot be managed in the patient's home, right? So this is very rare and very short. So duration is typically brief, a few days, must be medically necessary. There's no specific day limit, but this type of general inpatient care is for acute symptom control, not long-term care. So it's just someone is having some crazy episode. Maybe they're flailing and screaming and this or that, and they need to go to a special facility of the hospice so that they can hit them with the drugs and hit them with their, people there, not, maybe have them in their house, or they're in their house, who knows? But it's not the same as skilled nursing facility room and board. So Medicare covers room and board for up to 5 consecutive days per episode in a Medicare certified inpatient facility to provide relief for caregivers. So if some caregiver is like, all right, my loved one's in hospice, I've been trying to care for them day and night, I'm exhausted, I can't take this, I need a break, I've been at my wit's end, they might be able to get 5 days of relief at the hospice special facility just for those 5 days, just to give relief to a caregiver. Again, these are just rare, small exceptions. It's not the same as having that long-term stay in a nursing facility. So summarizing again what this means, choosing to go onto hospice care is a serious decision that should not be taken lightly. Not only is selecting hospice foregoing care to cure conditions, but is foregoing the Medicare room board coverage. This mix of conditions tends to make it so that hospice is only suggested once a patient appears to be on the turn toward passing, such as they're stopping eating and getting thin, where it appears that their death is imminent within a few weeks at most. The patient will be responsible for room and board under Medicare, but not for the hospice medical care generally. So again, Medicare will cover your hospice care, but they won't cover room and board. I just got to keep emphasizing that because that's kind of the big thing. That's the kind of the focus of this video. So other considerations here, if possible, make sure that all paperwork is signed by the patient for the patient or for the patient by a duly appointed power of attorney. So whenever you're doing your paperwork for signing somebody up within medical facilities, make sure it's the patient themselves being liable, or you're doing it as power of attorney for the patient. I do not recommend taking on the debts of your loved ones. There's no reason to. Generally, they don't. Skilled nursing facilities will take in the patient. They will take in, power of attorney signed documents. You don't need to put yourself, under a legal crosshair. There's been legislation that has restricted going after families. Don't let facilities sucker you in into trying to become responsible for a loved one's bill. You don't have to let them sign or be, duly appointed power of attorney and sign as power of attorney. So use your Medicare benefits wisely. Remember that the 100% coverage is only the first 20 days. If you go beyond that, there's a coinsurance amount to pay for days 21 to 100. So Medicare is not 100% all the time, just the first 20 days, but you can get pretty far if you have a secondary insurance to cover the rest, or you have the money to pay. Either way, but a secondary insurance might be important because it can be pretty expensive at $200+ per day. You may need to establish a qualified income trust to apply for Medicaid coverage to cover a long-term stay. This is what I was talking about before, where some people go onto Medicaid instead using a special trust. But that is a topic for another video because that's its own deep dive. So just note there is an alternative potential for coverage, but that is its own specialized topic. So thank you so much, everybody, for watching this video, this educational video. Please be sure to like, share, and subscribe to the channel. Hopefully you found this useful and interesting. Hopefully it saves you some headache and hassle when you're starting to look at this, maybe for a loved one, and you're figuring out, oh, well, what's this Medicare thing and hospice and nursing home stuff? This is kind of the beginning step in understanding what these things are and the considerations you have to be aware of when it comes to the financial side of things, because it's very easy for people to not understand or to get tricked. You may need to especially talk to possibly your attorney or doctor or both in order to flesh out your specific situation. Obviously, it's going to be nuanced to you and your specific situation, your area, but hopefully now you have a sense of what questions to ask with this presentation. All right. Thank you so much, everybody, again. And again, subscribe, like, share, and I'll be back with you on another stream. Take care, everybody.